All right. Hey, everybody. This is Melissa Kornhaus with Professionals United for Parkland. I am here with my colleague and friend, Brian Gong, who is also a licensed mental health counselor. Brian, you want to introduce yourself quickly, who you are, and what you work with primarily in private practice?
I specialize in addiction and trauma, and I found, unfortunately, that they seem to go hand in hand.
Yes, they absolutely do. So, we want to do this training today quickly to kind of give some information for parents and for students, teenagers, people around the Parkland community who want to know a little bit about how maybe drinking or smoking excessive marijuana or using different substances might be related to what happened at the high school on February 14th and the tragedy. So, Brian, really quick, could you just define for us what trauma is?
So, trauma is any experience that an individual might have that's so overwhelming the brain can't seem to process it fully. And people typically experience a stress reaction that includes being hypervigilant, keyed up, feeling of impending danger. Even though the event is long past, they still feel as though they're there's often intrusive symptoms, images, thoughts popping into their mind when they least expect it, nightmares, and an avoidance. It's very common for people to have such disturbing experiences in their body and emotionally that they try their hardest to avoid any reminder or any thought of the event as it brings these things up.
So as you're talking, and I'm thinking about, how sometimes people may be comfortable having a beer at the end of a long day to kind of take off the edge of stress. It really makes me think of what might be happening for people who have gone through a trauma and they're experiencing those emotions or wanting some of that avoidance. It makes a lot of sense that those things might come into play. Now, I know this isn't your area of expertise, but could you kind of just give us a little info about how grief might be linked in with trauma in this situation, or what some of the overlapping symptoms of trauma and grief might be?
Sure. Um, so grief and bereavement occurs after the major loss of a loved one, a relationship, a job, a pet. It's the set of reactions that a person might experience, such as extreme sadness that may come in waves, anger, um, physical symptoms like problems sleeping, headache, issues with their digestive system. With grief and bereavement, typically someone might have an aching sense of longing for a person, a yearning for the deceased individual, and whereas with a traumatic stress reaction, it's more of one based in fear. Um, but there is a lot of overlap. Sudden loss of a loved one can be traumatic,
Mm-hmm.
and sort of propel a person to experience those traumatic stress symptoms. And I think there's a difference between what a person would consider normal grief versus what's called traumatic grief or complicated grief, and those two terms can be used somewhat interchangeably.
Mm-hmm.
Especially with the Parkland shooting, there were people that obviously died, but they died in such a violent and sudden way that it poses a lot of other issues besides, whereas a situation, if you anticipate death of a grandparent, for
Sure.
example, and are able to prepare emotionally, and not to mention that a lot of these people who lost loved ones were actually um, in the crisis as well. So they had their own
Mm-hmm.
overwhelming experiences. So, it's important to really assess and identify what's happening in the body, whether it's trauma, grief, or a combination of the two, in order to inform the treatment that is prescribed.
Gotcha. Yeah. And so you're talking about these body reactions, the emotional reactions, and the complications of having trauma and grief kind of interwoven. Um, so then, if we look at all this that may be happening for people and talk about substance abuse or substance use, just maybe misuse or a little overuse compared to someone's normal amount that they drink or smoke or consume of some kind of substance, what have you seen or what might be happening out in the community as far as substance abuse?
So let me just start by saying that I have a ton of empathy for what these individual survivors must have experienced. It must be awful, and the lingering effects, the emotions, the body sensations that they could be having as a result must be a terrible experience. And so to want to avoid feeling these things is pretty easy to understand. And at the same time, there's a sort of a paradox where the more you avoid something, the worse it ends up getting. And unfortunately, substance use is maladaptive. It's very effective at making a person feel okay and experience some relief short term, but it can cause so many complications in the long term. Obviously, the short term complications, or the acute risks of using drugs, overdose, any harmful effects that you can have, any secondary complications from missing school, not being able to function appropriately, things of that nature, possibly developing a chemical dependency over time, and also using substances to avoid feeling the stuff prevents you from being able to work through the stuff, and over time, that defense. That psychological defense that alcohol or other substances creates ends up being problematic for treatment.
Sure, yeah. So you're talking about short term, it puts you at risk of just not functioning as well, losing sleep, being tired at work or school the next day, maybe even possibly getting a DUI. I mean, I've seen two family conflict come out of this, whether one family member is using substances more than they did before, or parents are finding out about teenagers who are maybe being a little less cautious in their use of alcohol or other substances right now. So there's a lot that can come out of this. So I want to ask you, when is it problematic? Like, when is it really a concern where a parent or a friend of someone else, or even a child of a parent who may be struggling right now, when is it problematic that they're using substances in the way that they are? How can you tell?
That's a good question. I think it's probably different for everyone. If the motive behind using substances to self-medicate and to avoid any of these difficult emotional experiences, then I think that's problematic there. Mm-hmm. I think just the most important thing is for families to address the problem as it's happening. I think that parents sometimes have they feel very sympathetic for their loved ones' experiences. They feel bad for what their kid's going through, and they can understand that it must be awful. And I think it's possible to validate their experience and be supportive, while at the same time having good boundaries as a parent and telling them that the behavior's understandable but not acceptable, and there are other ways to learn to cope through it. And I think that parents have more leverage than sometimes they realize in being able to, sit down with their kids, give them support, but also push them into finding more healthy coping strategies. Using substances to deal with a trauma is certainly not a healthy coping strategy.
Yeah, especially not in the long term if it continues on. So sometimes just having a conversation lets the person know that you care and that you see what's going on, and that you're willing to do what it takes to help them find something that's going to be better for them to heal in the long run.
Mm-hmm.
Got it.
It's important for parents to be on the same page, so that it's seen as a family issue, and that everyone's together, and that the person using substances knows that there's sort of a unified message. There's no mixed signaling or splitting that can happen. It's going to cultivate a culture in the family where children feel safe bringing things to parents. It's really difficult to just identify a few symptoms. People who use drugs are withdrawing socially, their behavior is changing, their mood is erratic, hygiene might start slipping. But these are all pretty common symptoms or experiences that a person might have after a major trauma. And so you can't really just look at what's happening behaviorally. It's important to have a great relationship with your kids, so that you can help identify when problems, they feel safe talking to you about if they're struggling and things like that.
Yeah, so maybe especially in a situation like this, it would be very important to convey the message that we're here to help you with whatever. And instead of it
Mm-hmm.
being about punishment right now, we really just want to help you get what it is that you need to be able to make choices that are good for you in the long run.
Sure, it's not. It's nothing about punishment. It's not shameful. It actually makes sense in a way why someone would want to not have to experience those difficult emotions and body sensations. And at the same time, as a parent, we know that it's not going to be helpful long term, and it's all about what the kid needs instead of what they want. And it's a parent's responsibility to help them find more effective skills to deal with what they're going through instead of resorting to substances.
Yeah, absolutely. And so to kind of bring this conversation together, for me, I'm starting to hear a little bit of opportunity for what we call post-traumatic growth. Maybe it's building closer relationships with your children or with your spouse and working together through some of these things. Maybe it's learning strategies and skills that you didn't need to have as functional before because life was okay and now you don't have a choice. So maybe you're building up a toolbox that equips you to handle life. Those are some of the things that I'm seeing, but I want to give you, Brian, a chance to just say any, final message that you want to send that really jumps out to you, whether it's for a friend of someone who's struggling right now, a parent, or a child of someone who's struggling.
I have a lot of empathy for what everyone in the Parkland community is going through. There are very competent professionals out there willing to help who are trauma informed, who can assist in each person's recovery. I do agree that the concept of post-traumatic growth, when we go through hard stuff, we learn about our strengths. Our priorities change. We realize that we're possibly more capable than we thought we were. I do believe that there could be something positive that comes through it. But, the first step is recovery, getting people the help they need. And there is help there. I think that there used to be this school of thought that if you have post-traumatic stress disorder, you sort of just have to learn to live with the symptoms, but that's outdated information, and it's not true. There's evidence-based treatments that can effectively clear out those trauma memories and help bring someone back to normal.
Yeah, absolutely. All right. Well, thank you so much, Brian, for this information. I'm sure that, families and students and teachers will find it super helpful, and we appreciate your time.
Thanks, Melissa.